Sedev Bhatta breaks down as he pleads with staff in India's biggest COVID-19 hospital to admit his wife Lakshmi. She's lying in the back of an ambulance, breathing with the help of an oxygen cylinder. He tells Al Jazeera they came here after being turned away by other hospitals.
I have no one else except my wife and child, who I've left on the road with an acquaintance. There's no one to look after us. We aren't getting a bed, and I've tried many hospitals, but there's no one around to give us a bed. With folded hands, I've pleaded with the acquaintance to take care of my child.
Tensions run high outside the hospital, where family members tell staff they have nowhere else to go. But Lok Nayak already has 1,850 patients and only 1,500 beds. Staff told us hundreds are lying on the floor.
Our work is very hard. We try to help and guide people, but they don't listen. People are becoming very frustrated. Some even become physical.
But eventually, after waiting for hours, most give up and begin their search for a bed again, hoping to find a hospital where someone has been discharged. Despite being India's biggest COVID-19 hospital, staff at Lok Nayak told us it too is running low on oxygen supply. When the Delhi regional government took the matter to the High Court, India's Solicitor General told it, let's try and not be a crybaby. 50 people died in the capital after their oxygen supply ran out, and on Saturday, 6 patients died in the state of Punjab because of the same reason. Healthcare workers say they are helpless in the face of such a calamity.
We need oxygen immediately, and our persons are wandering here and there for oxygen, but there is no help, no hope.
Sedev Bhatta leaves Lok Nayak after his ambulance driver tells him his wife will die if they keep waiting there. Elizabeth Puranam, Al Jazeera, New Delhi.
More now on the international response to the situation in India, because the European Union has activated its civil protection mechanism so that it can send oxygen and medical supplies to India. Well, let's now speak to the director of the Duke Global Health Innovation Center, Dr. Krishna Udayakumar, who joins us live now via Skype from Raleigh, North Carolina. We keep saying that India is breaking global records with each passing day. Help us put that into some context. How does this virulent second wave of the pandemic compare to the resurgence that we were talking about in Europe or North America?
What we're seeing, unfortunately, is a tragic rise in India that puts all the other waves we've seen in other parts of the world certainly in perspective. Now, 350,000 cases a day and going up, which is the 4th day in a row of a world record. We're seeing more than 2,700 deaths a day reported. And we know that those are probably significantly undercounted, perhaps in an order of magnitude, because the test positivity rates are 18% or higher, in some places up to 50%. So we know that most of the cases that are actually happening are not even being reported. So this is a massive failing across the entire health system.
And the health system is in some collapse now, because obviously this crisis is feeding through into hospitals. The Indian government has announced that it needs to import something like 50,000 tons of medical oxygen as cases of COVID continue to rise, and hospitals are turning away patients in need of oxygen and ventilators. Now, how quickly can that process play out in terms of identifying vendors to purchase this from?
Unfortunately, it's already too late for thousands of people that are dying today, tomorrow. It is good to see the world rally, as you noted, with Europe, with the US finally making a statement and starting to make some movement. But the need is so urgent that waiting even days is not going to be useful when oxygen is needed by the hour and by the day. So anything that's possible to do is useful. We need to think about moving with greater urgency and also thinking about a much more comprehensive response. Oxygen is one part of it, but we also need to make sure that there are other supplies, therapies, and eventually enough vaccines to start vaccinating at a larger scale also.
Well, so then what about the vaccines? Because it just seems as though Seems as though India is following a similar trajectory to Brazil, where they're being hit by this double blow of vaccine shortage and much more infectious mutations of the virus.
It is, and we know that India has historically been the vaccine manufacturer for most of the world, and that's the irony here. 140 plus million doses of vaccine have been delivered in India, but that's not keeping pace with the need, just given the sheer magnitude of the population. And so we need to now move to a new phase where we continue to think about importing vaccines in the coming days and weeks, but at the same time, not over-rely on vaccines as the way out. We have to really think about all of the comprehensive public health solutions that are at our use and make sure that everything from lockdowns to social distancing, masking, and the urgent need for supplies are also met.
Well, obviously there were warnings early on and policy wasn't adjusted, but is there anything that they are not doing now, the central government? Is there anything they're not doing now that they should be doing?
Well, I think what we need to understand is what is the level of intensity of the response? Do we need to start seeing more, I would say, in terms of lockdowns, restrictions, really coupled with the ability to support people in terms of social services, in terms of access to food and nutrition? That needs to be a full response across the whole of government. Right now, there seems to be a lack of coordination between the central and the state governments. We know that healthcare in India is also largely provided by the private sector, and we've been in touch with many firms in the private sector that are willing to do more, but need to be coordinated more effectively also with the government.
I mean, that's quite a significant mobilization that you're speaking about there. A country the size of India with as many states as there are now, how does the central government get a hold of this, particularly if policies around those public health solutions are being delegated to the state level?
Yeah, I think first, making sure the communication is quite clear that this is a national crisis and the response needs to be a full of government response to a national crisis, to bring together the state governments more effectively and also the private sector, but also make sure that the right measures are being put in place, that election rallies don't continue, that large gatherings like religious gatherings also need to come to an end, because those have clearly become super spreader events.
Even if they do all these things, how far away are we from the peak of this crisis, and how much worse is it likely to get?
Yeah, that's unfortunate news. The latest projections, if you look from the University of Washington group, would say that the peak would be sometime in mid-May with as many as 12,000 deaths in a day. And by August, we may be seeing more than 900,000 deaths overall in India. Those are quite staggering figures. So the more we can do, the more quickly we can respond, the more lives we can save.
Well, thank you very much for giving us some context around a very important story. Thank you, Dr. Krishna Udayakumar, joining us there from Duke Global Health Innovation Center.